My name is Scott Challoner and you are listening to the Leaders Council podcast for the people who run the country and the people who keep the country running. It is a pleasant day here in the capital as the spring weather is upon us, and joining us on the show today to keep it very much in positive mood are four executives from Venus Healthcare, a specialist healthcare provider that owns and operates care homes in the Greater London area. Those joining us today are Mrs. Khin Nadarajah, Venus Healthcare's co-founder and CEO, Mr. Sri Nadarajah, entrepreneur and another co-founder of the group, Dr. Ramesh Nadarajah, who is a medical practitioner and chief medical director of the company, and also John Yip, the group chief operating officer. Welcome all of you, and by all means, thank you ever so much for taking the time to join us on the show today.
Good morning, Scott. Thank you.
Good morning, Scott.
Good morning, everyone. Now, just for the listeners tuning in today that may not be familiar with Venus Healthcare, the group has been successful in establishing and operating elderly care homes, or community care villages, as they prefer to call them, within the Greater London area, and now are looking to roll that solution out outside of the UK too. And with a global population that is ageing, I think it is fair to say that that's a much needed solution. Starting with you, Khin, the fact that the global population is ageing is a very well-documented issue, of course. However, it is likely to affect developed economies and developing economies very differently. So how would you describe the challenges that the developed world will face on the one hand and then the developing world on the other, please?
Well, Scott, thanks for your question. In the developing world, the economic development cycle of the economy will play a large part in the kind of challenges that is faced by the government and as well as the people. In the developing world, the allocation of resources in terms of the government priorities are different, and usually they tend to prioritize on the main economic drivers of the economy, and they tend to forget that what the elderly needs are. And usually what tends to happen is that the women of the families became the default carers, and as a result, in this day and age, women are also economic drivers, but as a result of lack of funding, as a result of lack of reliable source of care, the women become default carers. So in the developing economy, the main challenge that they face is to make sure that there is a reliable and affordable care in place, systems and infrastructure in place, so that the women can become economic drivers. And in the developed world, the systems are already in place, the governance, the infrastructure is already in place. But the issue here is that most of them are in a kind of a warehousing model that's already been where people live in a good facility, a good environment, but not necessarily in a rehabilitative scale yet. And the developed countries' economy having to support a life cycle, the extension of the life cycle, where people are living much longer than a generation ago. And those are the challenges that they need to take into account in terms of caring for the elderly. But the good thing that I can see, the opportunity coming out from the kind of difference in life cycles of developed countries and developing countries, is that developing countries can actually adopt what's already been tried and tested in terms of governance, in terms of care standards, and then adapt it to make them better, make them more suitable for their environment, but also at the same time try to be more rehabilitative, so that the elderly are not just being put in there to live out the rest of their life, but also give them that quality of life, dignity, and enjoyment in their later years. So that is the kind of opportunity that I see between, and then the interrelationship between the developed world and the developing world.
Mm. And when you talk about those developments in the developed world, such as the sort of that warehousing model that's come about and the need to change that, that's very interesting. That's certainly something that we'll pick up on them a little bit later on. Just going over to yourself now, John. If nothing is sort of done by way of a solution to this sort of ageing population issue that we're facing, how could that in particular affect developing or less developed economies? Just more in focus, please.
All right, thank you, Scott, for the question. By any measure, the developing and less developed economies would have a larger share in terms of quantity of older people by 2050. Just give you an example, right? Like Malaysia, the country we are working on now, by 2050, it's going to have 1/6 of the population be age 64 and above, right? So what this means that if this government in the developing as well as less developed economies do little to nothing to essentially put in a system and infrastructure to co-finance the economic consumption of the elders, which is also include the elderly care needs, what would happen that you will see that there would add tremendous pressure on the economically productive segment of the society. I'll just give you some examples. So if the government does not sort of provide grants, for example, or provide assistance beyond just facilities or giving social living assistance, something that's meaningful. So what happens? You will tend to see that the daughters of the family will probably leave the job and support the parents, right? And in this day of age, as Khin has sort of emphasized, women's contribution to economic production actually is very, very important. So if we shift the burden of financing to what they call the families, as well as the close relatives, invariably over time, we will see a massive reduction in the savings as well as investment. And in most of these economies, investments are the key driver to economic production. And I do not believe, having experience as well as live in the developing economies for a substantial part of my life, and I don't believe that the government can use a fiscal expansionary policies to basically counteract on a slump in perhaps like investment sector. So overall, the elderly care is what I would call needs a balanced approach as well as a shared responsibility stance in addressing the financing needs for this group of people.
So, Dr. Ramesh, if we go to you next, the World Health Organization has identified that although the health needs of the global population are changing, there's still little clinical focus on the real issues that affect older people. Why do you believe that's the case, and what must be done to try and address that?
Thanks for that, Scott. I mean, I think what we need to do to answer your question really is to look at the evolution of healthcare systems as they are in place at present. The whole evolution of healthcare systems have been based on a young working population. The needs of a young working population back then was essentially on the basis of injuries that were sustained during workplaces, injuries that were sustained during transport, and certainly things around the use of things like infectious diseases and everything else. These were the primary things that we saw then. So therefore, a curative model of healthcare needs was used whereby I had a problem, I had an illness, I had an injury, I saw my doctor or accessed healthcare, I got a diagnosis after investigations, and I then was treated and sent back into a working community where, if at all possible, as you can imagine. Things have changed, as you can imagine. You see, with all the advances that we've got now in safety, hygiene, health, with transport, and certainly the whole role of medical science is growing quite a lot. A lot of us are now sustaining injuries and living far longer. If you look at the life expectancy, say in 1920, an average person used to live between 40 and 50, with an average what we term as retirement or pensionable age between 30s and 40s. If you look at the inception of the NHS in the UK, say 1948, average person used to have a life expectancy between 53 and 58. Today, the average life expectancy is between 80 and 83. This is at least a twofold increase in life expectancy over a 100-year period. So what we're getting at, certainly what we're getting really good at is getting better with illnesses, getting illnesses sorted, getting injuries sorted, but we're not able to do is to switch off the process of aging. And this is the crucial problem. As a result of this, now we're seeing more increase in long-term conditions as a result of aging illness within a population who is no longer able to work. This is where the current global problem needs addressing. I think, look, if we were to sort of address this problem, we need some fundamental changes in both the approach of healthcare, the whole way we think about how do we provide care for the older person. What an older person, I think, needs and wants is a better quality of life, at an aged age, so to speak. Okay, so a lot of research that we've done in the past has shown that despite living longer, we're not really achieving a substantially improved quality of life. To improve quality of life for an older person, I believe, needs certain things doing. And this is very specific to the elderly population. Things such as chronic pain, mobility, cognitive function. These are the kind of things that needs addressing for a longer term perspective. Now, how do we make changes? This is also a second part of your question in terms of how do we make changes? Again, we need a much more integrated approach for managing longer term care. This involves a change in mindset, as I've said, a sort of change in approach. And what we need to talk about are the fundamentals of essentially providing care for the older person based on what is important for them, not what's based on for a general population. I've always talked about essentially a biopsychosocial model of healthcare and essentially looking at this process. And I think this would be a very good starting point. 3 healthcare questions need to be addressed with elderly care, which is illnesses which are arising from living longer, deteriorating, your overall physical state from the natural sort of fragility, which includes things like poor hearing, poor vision, poor mobility, and the general cognitive slowdown that affects all of us with time. These health solutions, in parallel with what I would say social networks, getting much more better, meaningful social networks for the older person, can improve quality of life with an increasing life expectancy. Simple things, simple solutions, in terms of managing much more suitable built environments which address community integration rather than exclusion must be one of the ways forward, really. So, I believe that technology has to be one of the things that we employ because we need to be able to sort of deliver effective, compassionate, yet discrete care technologies which are less labor intensive. Because this is the only way that we can sustain future longer term funding for essentially longer term elderly care, really. One good example of sort of technology which is in place at present is the use of telepsychiatry, for example, which monitors cognitive function by using a series of questions at home for an older person, and by then sort of completing tasks appropriate to that. This technology then monitors the overall deterioration in sort of cognitive function. This AI tool, I think, is quite important because it can plan care packages for a much more evolving individual for the longer term. We need to look at a global vision, really, because, as I said, the aging population is not going to go away. And we need to look at integrating healthcare needs and improving access to meaningful social networks. Only this can provide a life worth living based on an individual's needs and longer-term wishes. I think the sort of current solution that we have, which is the one size or one solution fits all ages approach of sort of healthcare systems is no longer a viable option, and I think this needs to change.
Yeah, absolutely. And when we consider the fact that sort of healthcare services in both developed and developing economies tend to be incredibly fragmented, and we've seen a lot of talk about that in the UK at the moment with the emergence of the new Health and Care Bill, for instance. Does that suggest to you that maybe more integrated care systems have to be the way forward in sort of a global sense?
Oh, certainly, yeah. I mean, as I said just now, I think if we don't integrate what we term as healthcare with and social care using appropriate tools that we have, I think, what is going to happen really is the whole quality of life that we see for the elderly population globally is going to deteriorate, and that's going to have a serious impact on all of us, both economically, socially, and all the other healthcare needs that we need to to sort of perform the function. So I think, an integrated package is the way forward, really.
Mm-hmm. And going over to yourself, Sri, now, I understand that what Venus Healthcare is doing at the moment is developing its own solution, which merges the delivery of healthcare with social care in order to provide elderly care on an integrated basis. So for those listeners tuning in that may not be familiar with that solution, do tell us more about that.
Sure, thanks, Scott. I think to answer this question, we need to understand two major fundamentals. One is the fundamentals of the elderly care illnesses, which I call the ecosystem, because everybody's illnesses are different, and everybody's illnesses are culturally based sometimes, so they have different sets. So we need to understand that. The second we need to understand is what we call as what Dr. Ram said, the evolution. So, okay, let's talk about the evolution first. If you wind the clocks back 60 years, you find that in the UK, in the 1940s, we used to have care facilities based on domiciliary care. So you have many people in one room, and then you have units of that. It's like a bigger hall with lots of people in it. Then the evolution then moved on to practices where we have many rooms, individual rooms, and in a big facility. So the average size of an elderly care facility in the UK would be in the region of 80 to 120 beds. I think the average is slightly higher as well, in my belief. But it's about 80 to 120 beds. This model of care, what we call, is warehousing. So we don't believe in that. And so the third model as part of the evolution is what we call rehabilitative care. So rehabilitative care means that we have to enable the elderly to lead their life as they would do so, as opposed to being marched from in their room to the dinner place, back into their rooms, because that is not rehabilitative. That adds a lot of pressure on primary care, on the NHS, and that's where you have a lot of primary care interventions in some elderly care facilities. So the second fundamental, as I said, is the elderly care illnesses. See, to understand elderly care illnesses, it is a lot to do with the first point I mentioned. It's about your built environment. So the built environment being conducive actually spiritually, motivates you to do more, activities, to socially interact, and then somehow you find yourself, you know what, I've forgotten about my so-called headache, so I've forgotten about so-called my back pain. It's about that. It's about trying to lead a normal life as much as possible, because it is inevitable that as we all get older, we are going to have medical problems. But that's not the reason to warehouse. And I find the where UK is at the moment, it's fundamentally on a warehousing phase. Now, what we are hoping to achieve is what we call a community care village. So our community care village creates what we call a healthy township. So within the healthy township, you have the care of the elderly. You have the key workers residing within that village. You also have guest facilities of the families who come to visit, and you also have commercial minor commercial facilities. So you recreated a safe environment. Is what I call inside-outside concept, where you're actually inside, but you feel like you're outside. So it encourages the elderly to do a lot more. And that's very, very important, because that's fundamental to everybody's mindset. How ill do I feel today when they wake up? No, you're not ill. You can go and meet friends, and that mindset has to change. And so that's very rehabilitative. And as what was mentioned previously, this is a long-term solution. As the aging parameters are getting higher, we need to have long-term solutions where people are able to live within a community, but yet feel safe and looked after within the community, and that's very important. So understanding the ecosystem is very, very important. Now, as mentioned earlier, tech advances are very important, because tech advances does three things for us. One is it reduces the operational cost, because as you know, we need to keep the care affordable. So, if it's not affordable, then we are then catering only for a very small portion of the population. We have to make it affordable for majority of the population, and the care village model enables that. So the technology, the tech advances makes it, shall I say, affordable by efficient operations costs. Second is also risk. It manages the risk. By having tech, we could manage our staff quality. We could manage the kind of interventions that's taking place. And thirdly, it gives the evidence to the funders, the local authorities in the UK, real-time evidence to what care is being provided. And these are the three things, that we need to provide in a what we call a ecosystem of a care in order to make it work. So to provide that integrated care facilities is the way forward, and understanding the key fundamentals is what's needed, and we have incorporated these fundamentals within our modeling, within our strategies. So in the long term, the Ministry of Health would find that it's got a consistent cost of looking after an elderly up to a longer lifespan, and that's what needs to be achieved. And I suppose that helps with the crystallizing of the products within each country as well.
Yeah, absolutely. And you are absolutely right in what you say about that. I think we do need a real sort of change in approach. I think that's certainly very, very true. And then going over to sort of yourself now, John, what challenges will sort of Venus Healthcare actually need to navigate in order to make that community care village project that sounds so incredible a reality now?
Thank you, Scott. I think the challenges we face are two-pronged. Number one is the general lack of understanding. Number two is what we call this mismatch of expectations. Now, let me start off with a lack of understanding. Now, from the various stakeholders that we are working with, let's start off with landowners. Now, the landowners / property developers in the various countries that we're working on, they would see elderly care homes as just what they call a real estate development play. For them, elderly care homes are nothing but, let's say, a condo, a block of condos, perhaps the inbuilt wheelchair-friendly facilities, as well as other acute care treatment required facilities. So to them, these homes just need to bolt on third-party services. So they're more interested in selling the homes, no different in selling homes, in selling apartments. So for local government, and because they have not seen the integrated care model before, so they always draw parallel to nursing homes. So by that, they will throw the entire rule book that pertains to governing nursing homes on something like what we're trying to do, and basically tell us that, look, this is what you need to comply, without necessarily understanding that our model is peculiar, our model is more human-centric, and over and above that, the people that we require to run these community care villages needs to be specially trained as well as recertified. Now, when it comes to investors and financiers, because they have not seen this kind of model before in their home countries, so by and large, you try to picture, is this a real estate development play? Is this a real estate time-sharing play? Or is this just a hospital? So in most of the time, because they put on such disparate lands and it becomes incumbent upon us to basically tell them that, look, hey, you need to look at this from a ground-up perspective, from a needs perspective, as what Sri has highlighted. So, in short, we do run into mismatch of these expectations as we speak to different stakeholders. But I think with sufficient knowledge sharing, I think the gap has been somewhat narrow. And if we can narrow this gap further and essentially bring them across to where we are in terms of understanding what we want to do with our business model, that in itself, I believe, would deliver a very effective and efficient ecosystem that allow the elderly to live with independence and dignity.
Yeah, absolutely. I think a real part of making that happen is going to be really kind of pressing the benefits of this ecosystem there, as you call it, for sure. And we've talked about some of the benefits that it will bring to elderly care already, just going back to you now, Sri, of course. But what other benefits will this community care village project bring that we really want to be pushing out there at this point in time?
The benefits to the community is the social interaction, the activities. And these are the two key elements of living longer. It's been proven, it's been tested by various associations, universities around the world. To look after elderly is to keep them active, is to keep them socially, integrate them socially with their peer groups, with their friends, with their families, and the benefits to the community. They could be the catalyst to a development where it creates a township surrounding them, as opposed to review care homes as warehousing units. We don't. We want youngsters to say, I like to live in that healthy township. As part of, yes, I accept that there is an elderly portion in there, but working and living together would actually enable both parts of the kind of age groups to understand each other, and that helps the community. Because we should not be placing your elderly in a care home and walking away from it. The responsibility carries on from the fact that you're part of that society, you're part of the community.
Yeah, it certainly makes sense from my perspective, and it is fantastic. It's not just, of course, helping elderly care, but it's sort of bringing those real community values back into the fold that you've talked about. And in order to kind of deliver this, really, just going back to yourself, John, before we finish up now, what time frame for the delivery of this project can realistically be expected? And indeed, in the short term, what are you really hoping to achieve this year in pursuit of these longer term aims to initially get the community care village off the ground?
Well, as we speak right now, Scott, we are into the advanced stage of master planning our elderly care homes or community care village development in Malaysia. We have actually partnered with a government entity who's going to join us as both joint developer in addition to being landowner. So for this year, we hope and we anticipate and we are confident that we'll be able to sign a joint development agreement with this government entity. And if all goes well, by perhaps end of first half of next year, 2023, we should begin earthworks in earnest. As also at the same time, I think we have sort of received a lot of unsolicited interest closer to home in the UK by various party stakeholders, including the public sector, of us sort of like implementing the integrated community care village that Sri was talking about in the UK. But by all means, those are still work in progress.
Even so, it's a fantastic vision that you have at Venus Healthcare, and I certainly do wish you all of the luck in the world in being able to execute that over the coming year and indeed beyond. And let's hope to see this project really take off in the near future, because it is incredibly exciting. And I must say, just given how enlightening it's been welcoming you all onto the show with us today, I'd relish the opportunity to have you all back on the programme in future, just to maybe provide an update on how the project is coming along. It was a real pleasure welcoming Khin Nadarajah, Sri Nadarajah, Dr. Ramesh Nadarajah and John Yip onto the programme today from Venus Healthcare Group, and I hope that everybody tuning in thoroughly enjoyed the interview. Until next time, you've been listening to the Leaders Council podcast with your host Scott Challoner. Take care and goodbye.